Are you looking for an experienced clinician with over 30 years of clinical experience? One who understands breathing behavior and how it relates to your health problems? One with a proven record of helping complex medical problems, and who has referred patients regularly by GPs and medical specialists for difficult problems because he thinks outside the box and practices an integrated approach to medicine? If your answer is yes, then please continue to listen. My name is Jerry Gajardal Singh, and I run the Health Equation based in London's Medical District, founded in 2004. Breath and life are obviously intertwined, as are breath and thought. It is by means of breath that we remain physically alive. We're born with the inherent knowledge to breathe correctly through our diaphragm. However, our own unique breathing patterns are influenced by many life events, especially during childhood. Our emotions influence our breathing patterns, and just as importantly, our breathing affects our emotions. I estimate that 70% of patients that consult me do not breathe properly. At first, this may seem strange, as breathing is a subconscious activity. However, unless we have an obvious breathing problem, such as asthma, a chest infection, or lung disease, we do not usually notice our breathing. You may notice in other people, or indeed yourselves, that we may sigh a lot, find it difficult to catch our breath, or talk very fast, which are all signs of not breathing properly. We call this breathing pattern disorder. It's no coincidence that Qigong, Tai Chi, Pilates, yoga, and meditation all pay significant attention to breathing as their main way of helping people relax. Many of these approaches have validated scientific evidence of their effectiveness in helping many medical conditions, from pain to cardiovascular disease. Many patients with medically unexplained symptoms, a significant proportion of those attending GP practices, will have breathing pattern disorder playing a part, if not sometimes the main part, of their particular problem. We need to understand that in diagnosis, the normal medical model tries to find pathology, an obvious disease process. Luckily for us, the majority of the time, no defined pathology exists. However, there is usually a cause of people's problems. The answer can often be found in what we call functional disturbance. The three main areas of functional disturbance are: number one, structure, which is generally neuromusculoskeletal and visceral function. The viscera, by the way, are the internal organs. Number two is biochemical. This generally is hormones, nutrition, and breathing. And number three is psychology, including conscious and subconscious patterns of behavior. What's interesting is that breathing links all three. You'll probably know that when we breathe in oxygen, and when we breathe out carbon dioxide. However, it's not as simple as that. Whilst the main aim of respiration is to get oxygen into cells to help with energy production and the many cellular reactions that our bodies need to survive, this action is dependent on an adequate level of carbon dioxide being present within our bodies. Almost always when people are not breathing properly, the issue is one of over-breathing. By the way, this may not necessarily mean breathing too fast. The effect of over-breathing generally means most patients have breathed out too much carbon dioxide. So the levels of carbon dioxide in our body drop, we call this hypercapnia, and so reduces the level of oxygen delivered to the cells of the body, we call this hypoxia. Ironically, trying to breathe more oxygen in does not necessarily help the situation. So how do I conduct a breathing evaluation? Well, an initial assessment, which lasts up to 1 hour, and it includes a case history, breathing questionnaire, clinical examination and assessment by capnography and heart rate variability. This allows me to ascertain if you are a good breather, or indeed, more likely, that you have a breathing pattern disorder. So what is capnography? This specialized piece of equipment measures carbon dioxide levels and breathing rate and is the most scientific method of diagnosing breathing pattern disorder. The capnometer I use also measures heart rate and heart rate variability. Now, you may not have heard of heart rate variability, but it's an excellent way of assessing the function of the autonomic nervous system, which controls almost all body systems. It's common to pick up ectopic heartbeats. These are simply missed heartbeats, which are often functional and related to lifestyle and breathing. Occasionally, I may suggest additional monitoring with a Holter 24-hour ECG analysis to decide if specialist cardiology referral is necessary. Once diagnosed, breathing pattern disorder can be subdivided into two categories. The first is intermittent overbreathing, which is mostly situational, for example, public speaking. The second is chronic overbreathing, i.e., it's occurring most of the time. The treatment for intermittent overbreathing can consist of the following: osteopathic manual treatments to improve neck function, including the nerve supply to the diaphragm, direct work to the thoracic spine, rib cage, and associated soft tissues such as muscle and fascia, to improve the local mechanics and decrease what we call sympathetic arousal. This is the stress part of your nervous system. Craniosacral and functional osteopathic techniques to stimulate the parasympathetic nervous system. This is the relaxation part of the autonomic nervous system. This can also reduce sympathetic arousal, again the stress part of the autonomic nervous system. Techniques to improve thoracolumbar function. This is the junction between your middle and lower back, to help adrenal support and release tension in the iliopsoas muscles, which directly connect to the diaphragm. And of course, breathing re-education, such as biofeedback exercises and gentle breathing exercises. Sometimes it's important to use nutritional support for the adrenals, including dietary change, nutritional supplementation, and something we call stress adaptogens. Supportive exercise to improve ribcage mechanics, posture, core stability, and muscle fascial flexibility. Occasionally, I might ask for an opinion from an expert hypnotherapist or psychotherapist to look at some of these subconscious patterns and situational emotional triggers. Chronic overbreathing is treated with some or all of the treatments offered for intermittent overbreathing mentioned previously, and in addition, the use of a capnometer and biofeedback. These exercises are usually necessary. Thanks for listening. This has been Jerry Gajada Singh at The Health Equation.